suppose, at the moment is that death rates still look relatively low. And looking across Europe, there is one country which has behaved very differently from the rest, has not imposed masks on people, has had a much looser lockdown, virtually no lockdown at all, has kept bars and restaurants open and so forth. And that country is Sweden. And they're now doing quite well. Is it possible that the rest of us have got it wrong?
Well, we do. We have a number of tools that work, and we know that many countries are implementing an all of government, all of society approach in different ways. And what is working in many countries is this testing, making sure that you find, you isolate, and you care for cases based on the severity of their symptoms, making sure that you're doing comprehensive contact tracing. These are the things that break chains of transmission. Other types of measures, such as stay-at-home measures, have helped in some countries because countries, needed some time to build up their public health infrastructure, get their hospitals ready, build up that testing capacity. And so some countries have implemented these tools in different ways. You mentioned mortality, and you look at the differences in mortality across countries, and you look at what's happening with mortality in Europe. And I think there's a number of reasons why we're seeing a lower number of deaths, particularly across Europe. First, is that most of the surveillance that begins at the beginning of a pandemic focuses on severe infections. And this is typical because these are the people who show up at healthcare. And so when testing expands and surveillance expands, you find people on the more mild end of the spectrum. Second, we're much better at caring for patients. We're 9 months into this pandemic, and we know a lot more than we did in the beginning. So with earlier case detection, people can be cared for quicker. And this means earlier oxygen support, respiratory support, and now we have dexamethasone for severely and critically ill patients. Next is that our testing strategy is very, very different than it was in the beginning, where many countries were really overwhelmed. Now we have much better testing across the world, and so more people are being tested.